Hey everyone, welcome back to our channel. My name is Brianna Wilson. I'm a certified dementia practitioner and the founder of Bambu Care, where you can find us at letsbamboo.com. So for today's video, we're going to be talking about 3 signs that your partner with dementia may need more care, okay? Now, this applies whether they live alone or with someone else. And what I mean when I say more care, what I'm talking about is maybe they need more supervision, they need more assistance in setting up their environment or the tasks that they need to participate in to make them more accessible to them and to help them be more independent, or maybe they need more guidance and hands-on care, okay? So sign number 1 is that their safety is at risk. Now, this could be due to their environment. Maybe it's not dementia friendly. So for example, they may confuse harmful products for safe ones, so like Clorox wipes for baby wipes, or cleaning products like Pine Sol and Fabuloso as something that's drinkable, or bleach spray as vegetable wash. They could be leaving pots and pans on the stove for too long, forgetting to turn the stove off, putting things in the oven and kind of forgetting about them, leaving the oven on after they finished using it. They may place inappropriate objects in the microwave or not know the proper settings to push on the microwave to put the food in for the appropriate amount of time. They could be mismanaging their medications, either missing doses or taking too much medication. Maybe they're having repeated falls. Maybe they're leaving the house unsupervised and then getting disoriented or lost. So those are just a few examples. But if you are noticing these kind of red flag situations, then you want to ask yourself, is there a way we can modify the environment or a task to make it safer or more accessible for our partner so that they can remain independent? Or do they really need more consistent and structured support to stay safe? And of course, when you make any changes or decisions, you just want to make sure that you're doing them in collaboration with your partner with dementia and not just making these unilateral decisions, okay? The second sign is they're struggling with daily activities. So if you're noticing that your partner is experiencing more difficulty with their daily activities and personal care tasks, like bathing, dressing, toileting, eating, it could be due to forgetting whether or not they've already done something. They may have trouble locating items or rooms. They may have trouble sequencing the steps to tasks, or they may have difficulty initiating tasks altogether or particular ones. For example, when they're alone, they may not really know what to do or the best way to initiate a task, well, what comes first, or they may have a hard time determining, well, what comes next. So if your partner is experiencing these types of challenges with their daily activities, then it's a sign that they need more support, whether that's clearer visual cues in their environment, or their environment needs to be just modified in some other way to make it more simple and accessible to them, or they need more guidance or hands-on care to be able to participate in the activities they need and want to do, okay? And then the third sign is that you're burning out. Even if you are a long-distance caregiver, you are not exempt from burnout. So for example, you may feel constant worry or guilt, like you're not doing enough, or you just feel bad because you're not there to physically help. You may struggle to juggle care decisions from a distance while still trying to manage your own life. Or you may just feel overwhelmed because you're having to witness or hear about these changes with your partner from a distance and you really don't know the best way to help. So regardless if you're supporting your partner from miles away or you live with them, if you're feeling drained, depressed, overwhelmed, you're losing sleep, you're neglecting your own health, then those are signs that something needs to change. And that change may be getting more support for both you and your partner, whether that's through enlisting help through family members or friends, moving in with them or moving them in with you if managing their care needs from a distance is becoming too challenging, or moving them someplace else if their care needs extend beyond what you can reasonably and are willingly able to provide without jeopardizing your own health. But please know and understand that needing help does not mean that you have failed your partner or you have let them down. It simply means that you need help, okay? So please be open and willing to ask for help and accept it. In fact, I recommend that you ask for help before you even really need it, okay? There is absolutely nothing wrong with needing help and getting help, okay? But those are the 3 signs that I wanted to share that may indicate that your partner needs more care. If you're interested, we also have checklists available to help you determine whether it's safe for your partner to continue living home alone by themselves or if they would benefit from a care facility. One of those checklists is called Living Alone Dementia Checklist. The other one is called Is It Time for a Care Facility Checklist. They are both available through the Treehouse with a paw pass. So if you're interested, you can visit letsbamboo.com/treehouse. Once you log in, you'll find them under the Resources tab. You can type in checklist in the search and then you'll see them pop up. I'm also going to link in the eye in the sky, as well as in the description box, a podcast episode that we did answering the question, am I a bad person if I put my partner with dementia in a nursing home? Okay? Now the short answer to that is no, you're not a bad person. But if you want more insights and if you want to dig into that topic a little bit more, be sure to check that out. If you're interested in the checklist, don't forget to visit letsbamboo.com/treehouse and grab your paw pass. If anyone has any questions or comments, please feel free to leave them down below. And of course, if you're ever in need of more support along your dementia care journey, please be sure to check out letsbamboo.com. Until next time, bye guys.